Hello, everyone. My name is Dr. Amit Sharma. I'm Chairman of Division of Pain Medicine here at Good Samaritan Hospital Medical Center, and I'm Director of Interventional Spine and Pain at Spine Care, Long Island. I'm here to talk to everyone about prevention of back pain. I'm not being paid by any company or hospital for this presentation. It's a short presentation, and most of the images are courtesy of Mayo Clinic and Cleveland Clinic. On the top of our agenda, we are here to talk about the recommendations to prevent spine pain, any options related to it, and in case you do develop any back pain or spine pain, how to deal with it. As you all know, after the age of 40 years, there are many recommendations from several societies all throughout medical community about getting annual physical examination, blood pressure screening, cancer screening, cholesterol screening, immunization, skin examination. Unfortunately, there is nothing more recommended about preventing or taking care of your back per se. Life after 40 is usually confined to doctor's offices or better in the examination rooms. There are at present no recommendations for your spine health, how to prevent it and how to manage in case you have a weakened spine. Navigation through Google is absolutely horrendous. The big question is, can back pain be preventable? There are certain lifestyle modifications that I'm going to speak about briefly, which could help you possibly prevent back problems. In general, many people who are looking into this information are the ones who have already suffered from an episode of back pain, or their loved ones might have gone through this torture in life. The four major agendas that we would briefly discuss are posture, exercise, diet, and supplements. Posture is hard. You learn these behaviors as you grow up. But if you want to stand for any long duration, the best option is to bear your weights primarily on the balls of your feet, keep your knees slightly bent, keep your feet and shoulder width apart, stand straight and tall with your shoulders pulled down and backwards. If you have to stand for prolonged duration, make sure that you're tucking your stomach in, keeping your head at level, and shifting your weight between one foot to the other. The four common postural tendencies are listed here. The normal one, as you can see, the shoulder, hips, knees, and ankles are pretty much lined in the same line. Sitting, make sure that you're distributing your body weight evenly on both hips. Your knees are slightly higher than your hips. Make sure not to cross your legs. Keep your feet flat and try avoiding sitting in the same position for more than 30 minutes. This is a good example of how a perfect sitting posture should be. As you can see, any monitor or devices should be at the eye level. Your wrist should be gently resting on the table, and your spine should be straight. Your knees are bent at 90 degrees. Driving, which we frequently do for commuting to our work, make sure that you have a lumbar roll curved lower to the back area. Make sure that your seat is close to the steering wheel supporting the curve of your back, and it should be close enough to allow your knees to bend and feet reaching the pedals comfortably. Here's a perfect example. You should not be leaning forward or extremely backward while driving. Lying down, make sure that your pillow is under your head and not under your shoulder, and make sure your thickness is allowing you to hold your head in a normal position. Try sleeping in a position that helps you to maintain the curve of your back. Avoid fetal position and sleeping on your stomach. For people who have already learned the behavior of sleeping on their stomach, make sure that you have a slight roll under your belly. Select a firm mattress and a box spring set that does not sag. This is one of the most common questions which are asked by our patient: do I need to change my mattress? Unfortunately, there are no strong scientific recommendations at this point, although studies have shown to some degree firm mattress or firm surfaces help your spine to have a support system. If you do have a soft mattress, temporarily you can even place a box board underneath it. So make sure that you have a lumbar support in the lying down position. And when you're standing up from the lying down position, make sure that you're not bending forward at your waist first. So this is a perfect example of lying down on your side with a pillow under between the two knees. And when you're lying supine or on your back, make sure that pillow is not under the shoulder, but precisely placed under your head with a small roll under your knees. If you have to lay down or sleep supine or on your belly, make sure there's a thin roll under your belly. Lifting, usual recommendations at this point is for adult population, do not lift more than 30 pounds by yourself. Do not bend forward as you're lifting something heavy. Stand with a wide stance and tighten your stomach muscles. Avoid lifting heavy objects above the waist level. Hold packages close to your body and take small steps as you go forward. As you're lifting up something heavy off the floor, make sure that your back is straight and you're using more of your knees than using your belly or back muscles. Probably if I can drill one most important message during this whole speech is probably that exercise certainly has shown to help prevent long-term back problems. Your back muscles and your belly muscles together form the core muscles. These muscles help to strengthen your spine, support your spine, and prevent any injuries from happening. Gentle weight training and non-impactful cardiac exercises have also been shown to have successful long-term prevention of having spinal problems. Dietary advice is, of course, green leafy vegetables, a balanced diet which contains some dairy products, avocados, berries, almonds, and lentils have shown to prevent long-term back problems. Last but not the least, many questions are raised about supplements. Unfortunately, there are no strong recommendations if one particular supplement has shown to prevent back problems. They're usually needed mostly for people whose bodies are not processing calcium and vitamin D properly. Make sure that you speak to your primary care physician before starting any supplements. If you have any prior intestinal bypass procedures, you have any food absorption difficulties, and people who eat few or no dairy products are the ones who actually need any kind of supplementation. And last but not the least, remember, supplements are just supplements. They cannot replace a healthy diet. Make sure that you're eating diet rich in vitamin D, calcium, and magnesium to build strong spinal bones, which will prevent having fractures in the long term. In case, despite taking all precautions, you do unfortunately are suffering or have developed an episode of back pain, the good news is most spine pain episodes are not serious. In fact, 25% of population at some point in the last 3 months have suffered from one episode of neck or back problem. Most of these episodes are not serious, and most of them resolve on their own. Usually time, over-the-counter mild pain medications, gentle precautions not to stress your spine, and physical therapy can resolve these episodes. Unfortunately, some episodes do deserve early medical attention. We call them as red flags. If you are above the age of 70, your pain has lasted more than 2 to 3 weeks, it started following a trauma, you're having tingling, numbness in your limbs, or you're having difficulty in controlling your urine or bowel, those are important signs to take care of your spine problem urgently. If you happen to be suffering from fever, nighttime pain, unexplained weight loss of more than 10 pounds over the last 2 to 3 weeks, or you have prior history of taking immunosuppressants, prior history of cancer, or you're actively taking any IV drugs, those are also important reasons that you should address your back pain rather urgently. How we at Spine Care can help in case you do develop any spinal problems, whether it's affecting your neck, middle back, or lower back, we focus heavily on educating. We investigate the reason behind your pain problem, and last but not the least, we help to control or even resolve your pain issue. There are several ways to treat episodes of back problem, from physical therapy to chiropractor, acupuncture, and if those options are not successful, interventional spine care or pain management is the next line of care. Less than 5% of people who suffer from long-term spine problem eventually need any kind of spine surgery. At Interventional Spine and Pain Management Services, we help you identify the root cause of your problem. These steps are called as spine diagnostics. We do several injections to help identify the root cause and even control or cure them. At Interventional Spine and Pain Management, we also offer a host of other interventions, including joint injections, bursa injections, tendon injections, and more recently, regenerative medicine has taken center stage at our practice, including platelet-rich plasma and stem cell treatment. Our contact information, in case you or your loved one ever need help, is 833-LI Spine for Long Island Spine. It's 833-547-7463. You can easily reach it by a phone or even text messages. Last but not the least, for more information, make sure that you call 631-376-4444 or visit Good Samaritan-hospital.org. Thank you very much.